but usually women start to see their acne coming back. And that's because, like we know now, the birth control does not actually regulate your hormones, it just shuts it down. And
Yeah.
so when you stop the birth control, those hormones that were shut down now get started back up again. But because they haven't been regulated yet, they go back to the same cycle.
Welcome back to the PCOS Holistic Coach podcast with me, Dr. Ami Patel, pharmacist, fellow sister, and coach. This podcast is an easy to listen to resource for your busy, on the go life. You will learn how you can live a healthier and happier life with PCOS from real conversations about managing PCOS and the symptoms with amazing guest speakers. Welcome back, viewers and listeners. Today we'll be discussing acne associated with PCOS with Dr. Tanvi Tijoriwala. Welcome, Dr. Tanvi. I'm so excited to have this conversation with you. Thanks for taking the time to be here.
Thank you for having me. I'm excited to talk about this as well. I have so much stuff to mention.
Good. It'll be really educational for everyone. So I'll just give a brief introduction to Dr. Tanvi. She is a naturopathic doctor and founder of the Skin Confidence Code program. Her program helps women with skin concerns like acne, healing it holistically and feeling confident in their skin without restrictive diets and expensive skincare. Through her practice, she aims to bridge the gap between conventional and holistic medicine in dermatology to provide better care for patients suffering from skin and hormonal concerns. This includes providing mental health support, nutritional counseling, and confidence coaching to empower people to look good and feel good in their body. That is really amazing because I don't think that a lot of programs include like that holistic, like mental health support and nutritional counseling and everything in one.
Yeah, that's one of the main reasons why I decided to focus on skin concerns was because there was this huge gap between, the conventional side and the naturopathic side, where not a lot of emphasis was given on mental health, on helping people feel more confident or feel more secure in their bodies. So,
No, that's definitely true. And, especially like me having PCOS and other clients I work with, and a lot of my audience has PCOS. And that's
mhm.
definitely one of the biggest things is not just like just confidence in general with PCOS, because it's not just the acne. That's like one factor for a lot of women. Other things like hair loss, unwanted hair growth, inability to lose weight and all of that goes into it. And all of that affects mental health too. So it's really amazing that you um, have all of that together.
Yeah, yeah.
So you mentioned a little bit about why you got interested in
Mhm.
focusing on skincare. Is that what you like always wanted to do when you first decided you wanted to be a naturopathic
Not
doctor?
at all.
Yeah.
Not at all. So when I was studying in naturopathic medical school, I used to really dislike dermatology because I thought all of the rashes looked the same. It was very boring and I wasn't interested in it at all. So I actually graduated as a general naturopathic doctor, which means that I treated everything and anything under the sun.
Mhm.
And then this it, through, I don't know, I guess you can call it a sign from the universe, but I started to get a lot of skin patients,
Mm.
and that was the one thing I noticed was they weren't supported very well. They were given band-aid solutions. They were not talked about, they they weren't coached on their anxieties. They weren't coached on mental health, on confidence, all of those things. In fact, I actually had an eczema patient who was 40 years old. So she was still struggling with eczema since she was little. And since she was little, she had only gotten steroid creams, just stronger versions, and then moved on to like an oral steroid medication.
Oh.
And she was just so frustrated when she came to me. And I was surprised that nobody had actually talked to her about the food she was eating or helped her with, other topical solutions that can help with the itching and the redness and the inflammation. And so I really kind of, it wasn't so much like I really loved dermatology. I love it now, but before I didn't. But
Yeah.
it was kind of this way of giving back to people and helping them in a way that our conventional system, unfortunately, is not able to.
Yeah, I totally agree with that. I love, your holistic approach, which is really, we can definitely relate to that because that's the approach I like to take with managing PCOS as well. Because, and I think you'll probably touch on this, but it just looks like it could be just a skin problem, like, oh, just a rash, it's localized, but actually, there's so many things from your whole body that goes into effect for your skin, not just like, oh, it's only on your face.
Yeah. Well, PCOS is a great example, right? The acne in PCOS is never it's never a skin problem. It's happening because your hormones are not balanced. It's happening because of internal inflammation.
Yeah.
And which is one of the reasons why when women that have PCOS just depend on skincare, it's not going to help your skin that much as opposed to actually taking like the whole body route of healing your hormones and healing that inflammation.
Yeah, so let's get into some of
Yeah.
that. What are your lifestyle changes that you recommend, like with diet or stress
Yeah.
management?
Yeah, that's a good question. I think one of the most important lifestyle changes, and this is something that is so basic and yet not implemented very correctly, is movement. I find that PCOS in a traditional form is a form of stagnation, which is why you have fluid filled cysts, or even with your acne, you have pus filled or something filled like acne that's on your face. So, in a traditional sense, we always look at it as stagnation. And how do you move stagnation? You have to move it out. And so, movement is such an important part of like an important lifestyle strategy that needs to be implemented because that will help move some of that stagnation. Now, when I say that, one of the things that, and obviously, like you said, with PCOS, weight loss is one of the things that people look into. And when we talk about that, it's always like the very hard, high intensity kind of exercise, yeah, that people go towards first. And that's actually counterproductive for your hormones because when you're hitting that hard, when you don't have enough energy, when your cortisol, which is your stress hormone, is not regulated, and you're going very hard at the gym or doing CrossFit or high intensity exercises, it's going to be really hard on your hormones. So I always like to use the water analogy, which is there's a lake which is stagnant. It doesn't move quite a bit. There's a river that's flowing, and then there's a waterfall, which is like that
Yeah.
boom, boom, boom. You kind of want to do movement more like a river, not like a waterfall, not high intensity, and not absolutely no movement like a lake, more like a river. So something that in our terms, we call them yin building exercises. So they're more like nurturing, they're more slow paced, they're more uplifting rather than exhausting. So things like walking. Walking is my favorite type of exercise that I love recommending to patients because it's something that can easily be implemented in a busy day. Something like yoga, but not so much just resting yoga. It's more yoga that can also activate your muscles. So we like to call it like strength yoga or just slow paced workouts. So using your body weight to do workouts to begin with, or lesser weights, and then going more slowly or more rhythmically throughout the workout. I think that's one of the most um, profound lifestyle hacks that I've seen, especially with my patients, that have made a huge difference.
Wow, I did not expect you to say that. And like thinking about exercise to improve your skin and acne. So that's really something pleasantly surprising that I learned. And I love that water analogy, the lake, the river, and the waterfall.
Yeah, we often tend to forget that our skin is actually a detox organ,
Mm,
right? So when we're
yeah.
exercising, when we're sweating things out, we're actually sweating toxins out as well.
Mm,
And
that's good.
that helps the skin rejuvenate. You know what they call the post workout glow? That's actually a thing. It
Oh.
actually helps your skin rejuvenate and just detoxify toxins that are not going through your body. So yeah, pretty profound lifestyle trick.
So for then, like walking and things, do you like recommend like speed walking so that you get a little bit of like sweating, or so like a little bit more than just like a casual stroll? Is that what you recommend?
Yeah, totally. So it can be a combination of both. One of the things that really, really helps is obviously taking a walk out in nature, because that adds more to the stress management part of
Mhm.
dealing with your hormones and your skin, right? Because stress can play a huge role in both PCOS and acne. So walking out in nature, going on a hike that, kind of it's more up climb if possible. If not, then, speed walking is fine as well. Some people like running and they do well with it. I always say choose an exercise that makes you feel good after
Mhm.
rather than completely exhausted and depleted, because that's a good indicator of whether something is suited to your body or not. And that used to be my I completely failed at that, because when I started working out,
Mhm.
I would go very hard at the gym because that's what I was told. I was told that if you want to tone up, go hard at the gym. I would get very dizzy and almost faint after I used to finish my workouts. And to me, nobody educated me on that, right? It was like, this is the way to work out. This is what you have to do. You have to keep increasing your reps, keep increasing your weights. And then when I started to kind of start med school, I didn't have time to go to the gym. So I would just go on walks, or I would walk around in my room or in my house while I was studying. And I actually noticed such high benefits health wise just from doing that instead of, going very hard. So, yeah, a good indicator is just checking in with yourself and seeing, are you feeling good after working out, or are you feeling completely exhausted and dizzy?
Yeah, no, that's a great advice. And I think that applies for like not just workouts, but everything like food and things like that. But I think the things you touched on really go well, like with yoga and stuff. Like for PCOS, I recommend a lot of yogas that get the blood flowing, especially to like the uterus and things like that. So I think that goes along with the type of yoga that you're recommending too, not just like resting yoga. So yeah, that it's so nice to hear that, like, everything can fit together like a puzzle. And I think
Yeah.
women get frustrated because sometimes when they go to the doctor, they're told like, oh, well, you might be working out, but you're not working out hard enough. And so, or
Exactly.
you're not controlling your diet well. And so I think that's when we fall into that like, oh, restrictive diet plus over exercising mentality because we don't, but now it's like, good that we're having these conversations so people know that, for your body, it's different. And you have to listen to your body and understand that, if your body is tolerating this, then that's good for me. And if it's not tolerating the high intensity workouts and whatnot, then it's not good for me.
Exactly.
And even with the yoga, like just working up to it slowly, like no one is saying that you have to do like an extremely hard yoga
Hmm.
workout right away. But and same thing with walking, just working up to like a pace that you're comfortable with or doing the hills.
Yeah, yeah, yeah. These are all great kind of techniques to bring together.
Yeah. The next question I had is so with when well I can give my example too, but when women get diagnosed with PCOS and they have acne, sometimes they're like, oh, well, if you take birth control and spironolactone, then that can help with the PCOS and the acne. And that's like what happened to me when I first got diagnosed in my early 20s. I was having acne, and then I was told, like, okay, you can take birth control, it will regulate your periods and it will help
How
acne.
you say regulate?
Yes.
Because we know better now.
Yes. And so at that time I didn't know better. And I was like, well, I'm in my early 20s. And of course, confidence and skin plays like a huge role. And so I was like, yeah, if I can just take a pill and it will solve quote unquote all my problems, then why not? And so I did that, but I think a lot of women get shown only that path. So how like do you see patients that have breakthrough acne despite being on those medications? And what is your recommendation?
Yeah, absolutely. I do. So birth control works in two ways, I find. Some women will still get acne despite being on it. And those are the kind of women that will get very harsh symptoms and side effects from taking that birth control. So things like, having mood swings or a lot of weight gain and things like that. And then there's other women who find that their skin completely clears up. But then once they stop the birth control, it takes about 4 months, but usually women start to see their acne coming back.
Mm.
And that's because, like we know now, the birth control does not actually regulate your hormones, it just shuts it down. And
Yeah.
so when you stop the birth control, those hormones that were shut down now get started back up again. But because they haven't been regulated yet, they go back to the same cycle. So it doesn't really, it's kind of like a band-aid solution. It doesn't really deal with the actual problem. So in either cases, even when you're on birth control, if you find like you have clear skin, for most women I have seen it, their acne and their breakouts come back after they've stopped it, especially a few months after they've stopped it.
So then what are some supplements or things you recommend?
Yeah. Yeah. So with acne, obviously, it's a pretty complex condition. There's not one supplement that I would say, this is kind of like the holy grail. If you take this,
Yeah.
your skin is going to get completely cleared. But one of the things that I find that is very underutilized is vitamin D.
Mm.
And one of the biggest reasons why a lot of women in North America have tons of acne, especially in their adulthood, is because we're all deficient in vitamin D. We don't get a lot of sun here. And so it's one of those things that most people, not just women, most people are deficient in. And studies show that the more deficient you are in vitamin D, the more angrier your acne is, or the more aggressive your acne is. And so one of the things that I like to obviously test for is their vitamin D levels, and then supplement accordingly so that we are at least making sure that they're not deficient. Vitamin D also has very good anti-inflammatory properties. So all of that redness on the skin because of acne, all of the inflammation in your body because of the PCOS, it can really, really help with that. And then the bonus is it also helps with your mood. So, overall, you're feeling really, really good. But usually I start with probiotics and vitamin D if a patient comes in with PCOS type acne or just acne in general, because I found those two to be really effective in toning down the lesions.
That makes sense. Yeah, I think, vitamin D is a great vitamin for mood, like you said, and definitely interesting about the acne. I didn't know that either, but
Mhm.
it can also give you energy to do those workouts that you were talking about, like the yoga and the walking.
Yeah.
Definitely really good vitamin. But yeah, I didn't know that. So that's really good to know.
Yeah. And then obviously, working on other things like your diet, healing your gut, balancing those hormones more naturally. We have supplements that can help balance hormones. But obviously, you want to know first which hormones are out of balance. Like, there's not a one pill fits
Right.
all.
Yeah.
So, I always say acne is one of these things that you have to be patient with, but women can notice profound differences if they choose to go more the holistic route.
Yeah, I think that, like, it may take longer to see the result, but I feel like it will last longer because you're actually, like, getting to the root cause of the problem of what's causing the acne and healing that for long-term effect as opposed to a short-term solution, like just putting a cream on for one
Yeah.
whatever.
Yeah, yeah, exactly.
Are there, what about, like, I know you were mentioning, like, diet and inflammation a little bit. What about, I don't know, does dairy contribute to acne?
Oh, absolutely. Absolutely. It's one of the first, and I know most people get very annoyed by this because everybody loves cheese, or most people love cheese. But dairy is one of the biggest contributors to inflammation in the body, especially when it comes to acne. There's two reasons why, and I feel like when people understand that, they understand that okay, it makes sense why I need to cut dairy out. But one of them is because dairy has its own hormones essentially. Like they come from animals, and usually, if you look at humans, we produce milk when we have babies,
Right.
and that is a whole hormone regulated process. So those hormones obviously seep into the dairy. So when you're drinking milk or when you're eating cheese or having anything dairy related, you're also getting those exogenous hormones in your body that will then cause, an imbalance in the already imbalanced hormones that you have. The second thing is dairy has certain sugars in it that trigger something called the IGF-1 pathway. And what that means in layman terms is just your blood sugar is gets very dysregulated. And when it does, your skin tends to produce more oil. And when that happens, it clogs your pores and then causes more acne. So these are the two main reasons why we want to avoid having dairy products, because it can really help reduce the inflammation and oil production that is going on in your skin. Also, the hormonal imbalance piece. But I do want to say here, most women think that when you say you can't eat dairy, this is a lifelong thing.
That was gonna be my next question, like, does that hold?
Yeah, yeah, it's not. It's not.
Okay.
So what I do in my practice is I tend to ask patients what kind of dairy they like, or clients or patients what kind of dairy they like,
Mhm.
what they eat the most, and then we replace it. While we're replacing it with other alternatives, we start to heal the digestive system and the gut, because the reason also why your body is not able to tolerate these things and digest them appropriately is because of that lack of digestive health, or not the best digestive health. So we start to heal the digestion, and then once we do that, we can introduce it back in small amounts. So I have tons of clients and patients who eat dairy once a month. They'll have a pizza, or they'll have ice cream, and they'll notice one breakout, as
Mhm.
opposed to, like, their whole face becoming red and having tons of breakouts. And that's what I want to help patients and people get to, because not having a certain food forever is not sustainable. You and I, being South Asian, know that we consume a lot of dairy in our diet,
Mhm.
but it's not sustainable to completely cut it out. So what we do is we cut it out completely for a short period of time, and I don't say cut out; I always say replace, because there's so many alternatives to
Mhm.
eating dairy now.
Yeah.
And we replace it and then heal the digestive system and then reintroduce it again in small amounts, so that your body can still tolerate it and you're still able to enjoy it.
Yeah, that's awesome. I love that. I love that. I think it's really empowering because at the end of it, like, you know, we after that, like your client and patient can decide, like, hey, I understand my skin and body now. Like, if I choose to have this pizza or ice cream, I know that 1 to 2 days later I might have acne, and I'm prepared for it, or I know I can deal with it, as opposed to just feeling like, you have acne all the time and you just don't feel good about it because you don't have control over it.
Yeah, it's the control, the confidence, and knowing that, I know exactly what's triggering my breakouts. I know if I have this, I may get smaller breakouts, but now I know how to deal with them, how to get back on track, and that there is hope, that that there is a way to clear them out. Because I find, even, and I don't know if this is the case with PCOS. Accutane is not a PCOS drug. They usually use it for acne, but medical doctors will often say that's kind of the last resort, that's the last line of therapy. And so when people see their acne return after stopping Accutane, they feel very defeated. A lot of them feel like there's nothing else that can be done. And this is where this whole, like, holistic approach comes in, because it makes people feel more powerful and have more control, like you said, on how their breakouts come about and how to deal with them better.
Yes, exactly. Yeah. And things like Accutane, you can't be on it forever and it's not safe, like if you want to have kids. So it's always,
Exactly.
once again, Accutane's a temporary solution, like the spironolactone and birth control too.
Exactly.
Love that approach. I love that you like empower your patients to take control of the acne. That's so awesome.
Yeah, I mean, that's what we're here for, right? Like, we're here to educate and empower people, because, like I said, there's a better way of doing things, and most people aren't aware of it, and that's why you and I are here.
Yes. Another supplement I had a question about is zinc. Does zinc help with like decreasing the inflammation and acne?
Yes, zinc is it's one of my favorite supplements. It helps decrease the inflammation quite a bit. It is actually really good for acne scarring as well, because zinc is one of those minerals that are used in wound healing. essentially. So one of the things that I do recommend is zinc. But here's the controversy with zinc, especially when it comes to PCOS, because as people probably know, PCOS. When women with PCOS have acne or excessive hair growth, usually it's because of what we call hyperandrogenism or high androgens.
Mhm.
With zinc, there are some studies that have shown that it increases testosterone, and there are some studies that show that it doesn't cause any effect in testosterone, but only helps reduce inflammation. And so when I have a patient with PCOS, I'm a little careful on recommending that. It's one of my go-to supplements for acne in general, but if I find it's aggravating someone's condition, it's likely because in their body it's probably converting into higher testosterone.
Okay, that makes sense. Yeah, I think zinc can also for PCOS help with like insulin resistance. So I think it also goes back to what you said, like it just depends on you and it's different for everyone. It's not a blanket treatment plan for everyone.
Yeah, and like our bodies are really amazing. They give us a lot of signs and a lot of signals.
Mhm.
We just have to kind of keep our ears open and eyes open and listen to them.
Yes, I totally agree with that.
I'm glad we're on the same page.
No, seriously, I tell like my clients that too, like, keep a journal, keep track of these things because even if you go to a doctor for help, like they're going to ask you questions, and you can always refer to, like, I did this and it caused me to have this happen. So our body is like the best thing to tell us, how everything is going. And, just like going back to the exercise example, like that's one way. If you listen to your body, you'll know what exercise is good for you and not. And same thing now with like the foods that cause you to have acne and not.
Hmm. Yeah, exactly.
Are there any topical options like that you could recommend, or I don't know if you.
Yeah, I like topical ointments that have tea tree oil in it. Obviously, please do not put tea tree oil directly on your face. It will burn your face. You either want to use it in a carrier oil, or there are certain brands that make topical
Okay.
ointments with tea tree in them. And the reason being, tea tree is very antibacterial. So it helps to reduce any of the bacteria, the redness, the inflammation on the skin. And there was actually a pretty good study that said that it works as well as benzoyl peroxide, which is sometimes the first line of treatment for acne. And so I find that it works really, really well just for when you have those active breakouts and you want to kind of curb them.
Oh my god, I'm getting flashbacks of like when I had to take that, and yeah. And it's like bleaches,
Benzoyl peroxide or tea tree?
benzoyl peroxide.
Okay, yeah.
Yeah. It like bleaches your clothes and stuff too, right?
Oh my god, yeah. It's not my favorite.
If only I knew then what I know now.
Yeah, I know, but this is why you're doing what you're doing so that,
It's true.
women that are in your shoes that you were back then can now know better,
Yeah.
which is great. Yeah, it makes me so happy when most for the most part, I work with women that have adult acne that are in their late 20s, 30s, 40s. But every now and then I'll have a teenager that comes into my practice or joins my program, and it makes me so happy because they are saving so much time from going through the whole circle of topical antibiotics, oral antibiotics, birth control, Accutane, all of that, only to then come back to me, when they're 30. But they save so much time, and that gets them more healthy, that gets them more happy, that gets them more confident. And so it always makes me so happy when younger women and younger girls are taking initiative with their health and actually going more the holistic route instead of opting for a band-aid solution. So, you never know. Someone might be listening. Someone who was at when you were that age, someone that age is now listening to you and thinking, okay, I'm gonna give this a shot and have a better life.
Yes, I hope so. Especially like, they can connect with you and learn from your resources.
Oh yeah, absolutely.
I think that, I think that I'm trying to say this in a very nice way. I feel like sometimes people come to like naturopathic medicine as like a last option based on like how
Mhm.
you're describing, but I think now with like raising more awareness and education, people can realize that it's not a last option, but it's an option that I can do now as opposed to let me try all the Western options and then go to that.
Exactly. Yeah. I think that would be our society would be a lot healthier if they chose that as their first option, and then when things are, going out of hand, go more towards the Western. I mean, they can both, there's a place for both
Right.
medicines to coexist. It's just a matter of, educating yourself to know when to use which. So there, in certain cases, like with PCOS, with acne, holistic medicine works a little bit better because like you said before, we're going to the root cause, we're targeting more the inflammation, it's more long-term sustainability, whereas obviously if you have other conditions you need to get on medications right away.
Yeah, I totally agree with like what you said that they both can be together, and same thing with acne itself or just PCOS. Like there's a place where you can do both, or you can try Western medicine while getting to the root cause and doing these holistic
Exactly.
changes. And then so when you come off of things like birth control or Accutane, you're not having that, all your symptoms.
Flare up, yeah. Yeah, yeah, totally.
So I know we talked about for acne scars, like I know like me for example with darker skin, I feel like my skin
Yeah.
are like darker and they stay around longer.
Yeah.
So I know you said like tea tree oil in certain products and zinc. Was there
Tea
any?
tree oil was more for acne.
Oh, okay, okay.
Yeah, for scarring, anything with is anything that has what we call like a tyrosinase inhibitor can work really, really well. So stuff like azelaic acid or kojic acid, or conventionally, there's hydroquinone, but I don't like that quite a bit. So I typically tend to go towards like vitamin C, azelaic acid, or kojic acid. Those are great options to minimize like the hyperpigmentation and the scarring. Obviously, if your scars are very deep, you're probably going to need some physical intervention, whether that's microdermal needling or facial acupuncture, whatever it is, some sort of physical treatment works a little bit better for more of the deeper scars.
All right, good to
And
know.
then oral zinc, because zinc can help with wound healing. And that's really, really important when it comes to scarring.
All right, awesome. I learned so much in this. Thank you for educating me and the
My
viewers.
pleasure.
Was there anything else you want to mention that we didn't talk about?
No, I think we covered all of it. Just overall, I think this is a good platform that you've created to empower people to, have more options, have more control over their bodies and their health. And for anybody that feels, defeated, or that's tried too many medical options and they feel like they don't know where to start, this is a good place to start because you can learn so much about your body, about your health, about PCOS, about acne, all these other conditions that you talk about, and it's a good place to empower yourself, educate yourself, and see what other options are out there and available.
Oh, thank you. You're so sweet.
Yeah, of course.
Thank you so much for the work you do as well. It's awesome that you're doing that holistic approach, especially with the mental health aspect. I absolutely love that. If anybody wants to work with you or join your program, how can they reach out to you?
So there's three ways. One of them is my favorite platform is obviously Instagram. So I'm always on there. So feel free to DM me. I think my handle
Yeah,
is
I'll put it in the
down
description. Yep.
in the description. You can also send me an email, which is also down below. And you can check out my website. I have some great blog articles and recipes up there. But yeah, these are the three main ways to get in touch with me.
Awesome, awesome. And then you work primarily in Canada, right? So if there's any listeners that are local to Canada, they can find your program.
I work all of North. So my program is designed to be able to work with people that live outside Canada as well.
Oh, awesome.
Yeah, yeah. So that. But if anyone lives in Ontario, I do work. I have a clinic, so I can see them physically if that's something they like. But the program is designed so that anybody living outside Canada can also join and still get the benefits.
Yes, that's so awesome. The power of internet, make
Yeah.
accessible and allowing us to connect and have this
Yeah.
conversation. So really awesome. Well, thank
Yeah.
you again for taking the time out to have this conversation with me and educating us all.
Thank you. Thank you for having me.
And just to do my outro to everyone, be kind to yourself, be patient, and focus on progress, not perfection. I'll see you guys next time. If you loved this conversation, please leave a review and share it with a friend. I would love to connect with you. You can find me on Instagram and TikTok at pcos.holistic.coach. Send me a DM and say hey. Be sure to tune in to the podcast next time.